Welcome to day 4 of the I4 intervention, and today we are joined by Dr. Camilla Edwards from the UK, here to teach us about veterinary ultrasound for the veterinary technician or nurse, and how it is absolutely essential that we learn this skill because we are essential to the team.
In general practice, but I also think that nurses and techs are underutilised and undervalued as well. And it's difficult for the tech or the nurse to find specific ultrasound education for themselves. So just over a year ago, I set up a course specifically online for nurses and techs, and I've had really good feedback. Now, I'm not sure about the US rules around techs. In the UK, we have something called Schedule 3, where we have to ensure that we're delegating appropriately to a tech or a nurse. And I think ultrasound is one of those places where there definitely is scope for us to do that and for nurses to become more skilled at ultrasound and really benefit the patient all round, particularly in the emergency scenario. I think it's such a useful triage tool, and many places are not fully utilising their nurses using that tool, or let alone just ultrasound using that in those scenarios. So a little bit about the online course that I run. It's 6 weeks long, and we cover a variety of subjects. So first week we cover patient preparation. Week 2 is all about the ultrasound machine, settings and probes. And I'm really keen that you learn how to use your own machine rather than learning here's the physics, apply it yourself. I want you to ask me questions about your machine. I review machines, so I'm very familiar with lots and lots of different machines, so I can help you out if you're struggling to work out your particular machine. Week 3, we look at ultrasound language and artifacts. That's really key for, understanding reports, what's contained in those reports, and just understanding how to describe an image that you're seeing. Week 4, we look at ultrasound in the emergency patient. So we've probably all heard of fast scanning, so we're covering that. We're also looking at a little bit about scanning the abdomen and the thorax in the emergency patient. Week 5 will cover abdominal organs, so just give you an idea of what normal looks like and how to get those normal images. And week 6, we look at ultrasound guided sampling. I think this is a really key area for technicians as well as the emergency patient, because when we're sampling pathology in a patient, it's really key how to look after that patient, nurse them, particularly afterwards. If you've done a biopsy or a fine needle aspirate, we need to think about what we need to monitor, what the risks are with regards to bleeding, because that varies from organ to organ and what we're sampling. So each week on the course, we've got a pre-recorded webinar. There's a quiz and some tasks, and you can share your results with those tasks on an online community with discussion boards. And it is RACE accredited. So if you want to find out more about that, go and visit www.fovu.co.uk. So yeah, that's the bulk of my business. I'll just give you sort of a sample of the first week that we go through, what we're looking to get out of it. So the first week is all about preparing the patient for ultrasound. So we're really looking at understanding how to prepare the client for their pet undergoing ultrasound. I don't know how it is in the US, but in the UK, often people are quite surprised as to how much fur needs clipping off. So really understanding how to put that across to the client, and how to set off enough time, how to book enough time in appointment slots, etc. But also thinking about preparing the room. the machine, setting it up, equipment, how to set up everything for an ultrasound examination. And then what I think is really key as well is making sure that everyone's as comfortable as possible throughout the exam. And that includes the patient, so making sure they've got enough bedding, particularly considering if they're an older patient, do they need a thicker bed to protect their joints, because they're going to be in the same position for quite a while. You're going to be in the same position for quite a while, holding the animal or scanning the animal, so good posture is important, and good seating position is really, really important. So that's sort of the gist of what we cover in the first week. I'll just explain a little bit about as well, because this is one of my favourites. Not everyone's as passionate and into machines and the physics and the settings as I am, and I know that, so I do try and simplify it as much as possible. And what I really want is for you to understand your machine. You don't need to know how every machine works. You just need to figure out how to use your machine, how to set it up, how to input patient details in your machine, how to select the right probe. If you've got a choice of probes or transducers, then knowing which one is the best for the case that you've got in front of you, and how they're often got presets within the machine, so choosing how to choose the best preset, and then how to set up the ultrasound machine, understanding which are the most important settings on the ultrasound machine and what effect they have on the image. So we go through quite a few things such as frequency, depth, gain, time gain compensation, and focal zone. Those are sort of the key buttons, and go through what they all mean and how they influence the image, because that's really the key thing, is understanding how and why they influence the image, because then you can adjust them and get the best image possible. So a little bit more we can look at. It's not opening properly. I'm having the tech issues now. So yeah, just to explain a little bit about the differences between the ultrasound machine types that you might have in your practice. So you might have a handheld machine. They're getting really popular. They often work with a mobile phone, which is really handy. And we're often seeing those used in emergency and critical care clinics. We've then got the portable sort of laptop-based machines, which again are really, really useful, and they're often a bit more advanced than the handheld machines. The handheld machines are getting there, but the portables still have got the edge. And then you've got the cart-based machines that you'll often see in referral practices. So these are the big machines that you wheel from room to room, and they have got huge capacity and are generally, the better machines. But often you'll also see the ex-hospital machines as well, and they tend to not be so great for our veterinary patients. A little bit about the probes that we might see. So we've got microconvex probes, where we have a beam shape that's convex. These tend to lie in sort of a middle frequency range, and you get good depth images. You've got a small convex footprint, so that's where the transducer touches the animal. It's a very small area, so that's really useful for cats in particular, and smaller dogs. Large footprints, so the large area where that's touching the animal can really put a cat off, especially. And they can be used for abdominal and basic cardiac imaging. I'm afraid the pictures aren't coming up. I'm sorry about that. Linear probes have a beam shape that's rectangular, so they have they tend to be higher frequency, and you get a poor, deep image. They have a large footprint, but what they are great for is for superficial structures and areas in cats where you're not having to push too hard. So they have a good big footprint, so you don't want to be looking underneath the rib cage at the liver on a cat, but they're brilliant for looking at generally the intestines and the rest of the abdomen. Finally, that you'll often have a phased array probe as well. So the beam shape with that is triangular, and it's tends to be low frequency with a very small flat footprint, so a very small square on the end of the transducer that's touching the animal, and these are really useful for echocardiography. So I'm really sorry that those pictures didn't come up, Alyssa. I don't know if anyone has any specific questions or anything they want to ask me. I'll be happy to chat about ultrasound for hours and hours, but
not a worry. We're having technical difficulties on our end, so
how are you?
I'm actually, so the recordings notification didn't come up because it's not working through Teams, so I'm doing it on my handheld, so it'll be a different type of imaging. So it's a universal technical difficulty day, but I know there's a bunch of you on there today that ultrasound has been definitely an area of interest, so don't be shy. Put your cameras on if you want to, and if not, just ask Camilla what you've got, those burning questions. Okay, I'm gonna go then. Where would you, for so someone that's just starting off in the ER as a newer technician or nurse, how would you recommend they approach this with like the attending clinicians? Like, I know we're all slammed. Lately it's super busy. So taking the course would be a great first step, but how would they approach that with the veterinarians to say, hey, how to be a self-advocate for this skill?
Yeah, that's it, and that can be really difficult because I think there's some vets will be really open to this and see it as a really useful addition to their tools, but I think there is resistance out there as well. So I think you have to grab those chances where there are vets that will work with you and appreciate what you're adding to the team, and where that happens, that will have a domino effect. Other people will see the benefits, and that will grow. Where you do get resistance, it is really difficult, isn't it? Because sometimes the more you press, the more resistant people get. So it's about chipping away, and the fact that this is race accredited, it's a genuine course. You can really present that to your DVM that you're working with as well, and say, look, I've done this. Please support me. Let me help do some cases with you. And I don't know, in the UK, vets are not taught ultrasound very well at university. I don't know how you find it in the US, Alyssa, but there are some vets who are would be less, have less of a clue than you guys will do after you've been through this course. So yeah, it can. There's definitely friction sometimes, but I would say grab those chances with those vets that will be on your team and support you. That is the main way to do it, isn't it?
That's brilliant advice. Thank you. Anybody else? Because I can ask her questions for days, honestly.
I actually have one, and I think you kind of answered it when it was like, grab the people that will be on your team if it's not something that is already happening, or it's not something that you're going to get a great response with. But I guess my question is if this isn't something that you are well versed in, maybe your doctors aren't well versed in, or maybe you are, but like, are there, in your opinion, do you think there's any other ways, like how can you support this initiative, even if you're not like taking the course, or maybe you don't have the people on your team yet? Like, how can you, like, what do you think the best thing would be to like support this initiative, or like to even just get it started?
Yeah, so I think, getting involved, even at sort of the basic level, sort of getting to know the ultrasound machine that you've got in your practice, if you have that, or if you don't, helping to create a business plan for the owner to make them sort of realize how valuable an ultrasound machine is in your practice, that every practice should have an ultrasound machine these days, and then it's so bringing it sort of back to basics, like really taking an interest, asking if you can be the nurse or the tech that helps consistently with diagnostic imaging. You're the go-to nurse that helps to handle the animals for those procedures. So then you're setting up the machine, you're getting everything ready, and once the vets are realizing that you actually know how to switch it on, you know how to put in the patient details, you know which probe they're going to want.